A lot of people don't understand what trauma is. They think of trauma as like if you're in a war or you were there for 9/11. And yes, certainly those experiences are traumatic. They're out of the ordinary, exceptional, devastating events. But in addition to that, there could be one-time traumas like car accidents. Certainly not as big a deal as being there for 9/11, but it can cripple you. It can mean you can't get back into a car.
Traumatic memories loop. In other words, if I asked you what you did today, you can tell me in a linear fashion. But when you experience trauma, what happens is you never connect the fact that you survived the trauma to the trauma itself.
It's really important to get to the symptoms first because clients can come in experiencing flashbacks, sleep disruption, depression, and anxiety. And so we must get to reducing those symptoms first before we can begin to really treat the trauma.
Sometimes people come to treatment because they have experienced horrific traumas in their childhood. And they either still are children or they've grown up and become adults who have been living with childhood trauma all their lives.
Having a parent that tells you over and over again that you're dumb, for example, has a very severe, traumatic, devastating effect going into adulthood.
One of the most effective therapeutic modalities for trauma is EMDR. It gives you the opportunity to have your rational, logical mind review the traumatic experience. It calms down the intensity of the emotional part, and you're able to then view the experience as something that happened in your life rather than something that identifies who you are.
And part of what we offer at IPG is the safe place for them to resolve those traumas.